Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Vitamin E is a very well-known nutritional supplement. It's a chain-breaking antioxidant in fatty tissue. Now, considering the brain is about 60% fat, hopefully good fats, it would seem that vitamin E should be very important for protecting brain health, and that is turning out to be very true. There's two families of vitamin E, and it turns out that not all vitamin E's are created equal when it comes to protecting the brain. Hi, my name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the Chief Scientific Officer over here at Invite Health, and welcome to our episode, Tocotrienol for Brain Health. So the original vitamin E that you're familiar with was first discovered in 1922 by researchers at the University of California. It's an important factor for fertility, and its name is derived from the Greek words meaning birth and to carry, so for labor, etc. There are four members of this family collectively known as tocopherols. The only form of vitamin E that has an established daily value is alpha tocopherol, meaning that the government deems this vitamin is needed at a minimum for good health and to sustain life. In 1964, a whole different family of vitamin E was discovered, and it also has four members in its family. These are known as tocotrienols, and research is finding that minimum levels are likely essential for brain health. This brings the number of known variants of vitamin E up to 8, 4 tocopherols and 4 tocotrienols, and it seems that you need all four for memory health. Now, a very recent study prompted me to record this episode. Researchers in Japan gave elderly adults with memory loss a combination of astaxanthin, it's a carotenoid, and the 4 tocotrienols, and the researchers found that within 3 months, the two supplements improved memory across a range of activities and was extremely safe to take, and that's what the research shows about tocotrienols. You only need tiny amounts. In fact, it was a very interesting study. I'm going to tell you this from memory. It was done at the Wexner Center over in Ohio State University Medical Center, and they had animals that spontaneously developed strokes. And they gave them tocotrienols in their chow, and they found out when they had the strokes that the vitamin E limited the amount of damage in their brain. But it was tocotrienol version of vitamin E, and they only had to give them tiny amounts. It seemed like nano amounts were enough to protect their brain. So they did a follow-up study with healthy elderly women, and they gave them tocotrienols, very small amounts. And they found that the amount of tocotrienol that entered their brain was 12 to 20 times the amount needed to protect their brain from a stroke if they did a ratio of the amount in the smaller brain of the animal versus the amount that would be needed in the human brain. So that was very interesting, very, very interesting stuff. In fact, the Wexner Center is doing ongoing studies giving people who had previous strokes tocotrienol to help prevent damage. God forbid they have a second stroke. You know, a lot of people do okay with a first stroke. They recover quite well. But if you have a second stroke on top of that, well, the damage is adding up and it gets harder and harder to recover. And they found that tocotrienol is one of the things it does in the brain, besides being a very powerful antioxidant, is that it seems to improve circulation, microvascular circulation to all these little cells throughout the brain. And that if you have improved collateral circulation throughout the brain, that even if you had a second stroke, this would limit the level of damage from that stroke, but the results of that study aren't in yet. So let's get back to that study from Japan. Astaxanthin is a carotenoid. Carotenoids are pigments in plants. We know of about 900 of them now. About 60 are used by the human body. You know a couple of them. You know beta-carotene, which can partially transform into a vitamin A, which is needed for vision and the immune system and healing, etc. You know about lycopene, that's the red pigment in tomato sauce that helps protect the heart and the circulatory system, and likely the prostate of men and the breasts of women, and it's incredible for skin health. I mean, lycopene is so powerful for skin health when you consume lycopene. And then there's lutein. It's an orangish, yellowish pigment that's found in green leafy vegetables, and that's really important for vision and memory. Well, astaxanthin's important too. It's an incredibly powerful pigment that's found in crustaceans, and it's pinkish. It's incredibly powerful as a lipid-soluble antioxidant. And there's a lot of great studies on astaxanthin protecting the eyes and protecting the brain and protecting the digestive tract and protecting muscles, etc. Great studies on astaxanthin. In fact, that's how flamingos get pink. When flamingos bend over and they're hooking up all those little crustaceans from the lakes, the crustaceans are loaded with astaxanthin. Flamingos are initially white and they turn pink. That's also what makes salmon pink. So they gave these elderly people in Japan who had memory loss. They had a foggy brain. They gave them astaxanthin and tocotrienol. And now this was a randomized double-blind placebo-controlled human clinical trial. It's published in the journal Clinical Biochemistry and Nutrition. So it's a state-of-the-art trial. They found within 10 weeks it improved composite memory. What? That means everything. I mean, the memory's complex. We have all different kinds of memory. And it improved verbal memory. It was very interesting. They used a scale. And on the scale, these people had a 4, meaning that during the week they were having trouble remembering people's names and the names of things. So they really had memory issues. I mean, imagine not being able to remember the name of a bicycle. So they had a 4. By the end of the study, by the end of 12 weeks, the scale had dropped to 3 for the intervention group. That means the people who got the supplements. So they were almost in the average range at the end of the 3-month study period. Now, here's a study from Ohio State University Medical Center. It's published in Annals of the New York Academy of Sciences in 2004. So they've been studying tocotrienols now for about 30 years. And they said tocotrienols possess powerful antioxidant, anti-cancer, and cholesterol-lowering properties. Well, all of those things are good for the brain. And they found that in this study from Ohio State University Medical Center, the tocotrienol, especially the alpha tocotrienol, was massively more powerful than regular vitamin E, even at very tiny servings. And it protected the cells of the brain from glutamate toxicity. That's very interesting. Glutamate is a neurotransmitter. We know of about 100 neurotransmitters in the human brain. They make the brain work properly. For instance, acetylcholine is for memory, and GABA is for kind of calming the brain and helping you learn, and glutamate's for exciting the brain and helping you learn. The problem is when glutamate gets overactive, it becomes an excitotoxin. It's an excitotoxin. It excites the brain cells to death. They work themselves to death. In fact, that's what happens in the terminal stages of Alzheimer's disease. Glutamate activity is out of control, and it's overworking the cells, and they're just burning out. You're losing all your brain cells. In fact, one of the drugs they give is for Alzheimer's disease in late stages is to slow down the activity of glutamate. So they found that even at tiny amounts, if they took neuronal tissue, and they applied tocotrienols, it protected the brain tissue from glutamate excitotoxicity and from a whole slew of other toxins to the brain. And they're finding that, yes, tocotrienols are very powerful as being neuroprotective agents and antioxidants in the brain, anti-inflammatory agents in the brain, even at very low dosages. So here's Ohio State University Medical Center again in Columbus, Ohio. It's the Journal of the American College of Nutrition. Now we're up to the year 2010. And they're saying a growing body of evidence supports vitamin E, and that the 8 forms of vitamin E are not redundant. In other words, even though they have crossover activity as antioxidants, they all have their own specializations. And what they found in these studies is you need all 8 forms of vitamin E to shield the brain. But alpha tocotrienol in particular was extremely important and more than likely essential. What happens over a lifetime, the lipids, the fats in the brain, become oxidized. They become lipid peroxides, and they could kill brain cells. And this does happen, and it becomes more common with age, of course. It accelerates with age. And they found that alpha tocotrienol is very powerful for preventing the fats in our brain from becoming rancid. That's very important. So let's go to some of the old studies on vitamin E and brain health. This is the old-fashioned version of vitamin E. These are your grandparents' version of vitamin E. Now, just a caveat on vitamin E. Natural vitamin E works incredibly better than synthetic vitamin E. So you always want to make sure you have natural vitamin E in your multiple vitamin or in your vitamin E supplement. And if you buy a multivitamin, you want to make sure it has some tocotrienols in it, some natural tocotrienols. I always make sure when I design a multivitamin, I put a little bit of natural tocotrienol in there. So these are researchers looking at data from the Canadian Study of Health and Aging. So these are a large group of people, at least 65 years of age. You know, they might have been 75. They might have been older. They followed them for 5 years. They gave them tests to ensure that they didn't have dementia, and 894 of them had zero sign of dementia. So they followed these people closely for 5 years, looking at the effects of antioxidant supplements to protect the brain. And they found antioxidants in general protected brain health and protected memory with aging. In fact, they found multivitamins. If you simply took a well-formed multivitamin over the 5-year period, it strongly cut your risk of losing memory functions. But they found in particular, combining vitamin C with vitamin E, or a multivitamin, significantly less likely to experience significant cognitive decline during the 5-year follow-up period. It cut their risk of severe cognitive decline in half. It's in the journal Dementia and Geriatric Cognitive Disorders. So the next study is from researchers at Johns Hopkins University. And they looked at data on almost 5,000 people, minimum age is 65. So all these people over the age of 65. And they found that if you took a daily supplement of vitamin C and vitamin E, in combination, it decreased the likelihood of developing Alzheimer's disease by 78% in the general public. But there was a catch there. It had to be a minimal potency. The vitamin C had to be at least 500 milligrams of a supplement daily, and the vitamin E had to be 400 units of vitamin E, natural form, or greater daily. It's in the journal Archives of Neurology. That's a journal of the American Medical Association. So now we're looking at stroke. Tocotrienols may prevent nerve cell death in the brain if you had a stroke. This is according to research on tocotrienols, the emerging form of vitamin E, not regular vitamin E. In any event, the researchers from, once again, Ohio State University found that vitamin E, and more specifically tocotrienols, help protect the brain from ravages related to a stroke. In the year 2013, the Karolinska Institute team of researchers published findings in the Journal of Internal Medicine. They actually were looking at different values for vitamin E is a predictive of Alzheimer's disease. In other words, we look for biomarkers in the blood for different conditions. And they're finding, according to their data, that if you lack vitamin E in your blood, it's a marker that you have an increased risk of developing Alzheimer's disease. So let's look at the details of this. The researcher, now the Karolinska Institute is a very famous research institution. In fact, they hand out 2 Nobel Prizes, one for physiology and one for medicine. But they don't hand out both in each year, so usually medicine rules. So typically they're handing out the Nobel Prize in medicine, and it's a huge research hub up in Northern Europe, up in Stockholm, Sweden. So they performed functional MRIs on patients with Alzheimer's disease and mild cognitive impairment and otherwise healthy brains. And they also took blood samples looking at all 8 different forms of vitamin E, which we would call isomers. Isomers mean they have the same chemical structure, but it looks slightly different in its arrangement. So they're all very closely related. All 8 forms of vitamin E are very closely related, the 4 tocopherols, the 4 tocotrienols, but they do have different activities each. They do have their own specializations to a degree. And he said, consistent with previous research findings, their study found from the Karolinska Institute in Sweden that patients with Alzheimer's disease or patients with mild cognitive impairment had lower blood levels of different forms of vitamin E. In fact, you could basically diagnose which condition they had by the levels of vitamin E they had in their blood. It showed that alpha and gamma tocotrienol, along with gamma tocopherol, are the most protective forms of vitamin E versus Alzheimer's disease and mild cognitive impairment. Now, mild cognitive impairment happens to up to 25% of people over the age of 60. There's shrinkage of the brain, there's loss of memory, the brain just is not functioning well. These people have trouble understanding complex instructions. For instance, if you're trying to explain to them how to use the GPS in their new Subaru, they may not quite get it. If you're going to show them how to use their new cell phone, it's going to be difficult for them to understand that. They're not going to understand the instructions to put their barbecue grill together. So that's mild cognitive impairment. You could still function in society, but it's obvious that you've lost cognitive function. It's obvious that you've lost memory to everybody else. The problem is most of those people are going to progress into full-blown Alzheimer's disease. About 80% of those people will slip into Alzheimer's disease. So according to this research from the Karolinska Institute, which is a very reputable research institution, tocotrienols and tocopherols are very important mixed together for preventing shrinkage of the brain, mild cognitive impairment, and Alzheimer's disease. So here's a study from a whole bunch of different academic research institutions in Europe. The University of Perugia in Italy, King's College in London, one of the most advanced research institutions in the world, Kuppo University Hospital, the University of Eastern Finland, Aristotle University of Thessaloniki in Greece, and a whole bunch of other academic research institutions throughout Europe, including in Poland and France. They published their findings in Neurobiology of Aging. And they analyzed a team from throughout Europe, analyzed data from the Add NeuroMed project. It's 168 people with Alzheimer's disease, 166 people with mild cognitive impairment, and 187 people with normal cognitive function. Everybody was at least 65 years of age. So they went from normal function to mild cognitive impairment to Alzheimer's disease. They ran the gamut. And here's what the results show. Compared to people with good brain function over the age of 65, people with mild cognitive impairment and people with Alzheimer's disease had lower levels of both tocopherols and tocotrienols. All of their vitamin E was off. Now, according to the researchers, mild cognitive impairment decline often precedes Alzheimer's, and they're correct about that. So once again, lacking all 8 forms of vitamin E, they actually put a figure on it. They found that the risk of mild cognitive impairment and Alzheimer's disease was 15% higher in people with lower levels of vitamin E. Not good. So now we're back to Ohio State University. It's the Journal of Cerebral Blood Flow and Metabolism. This is another study from 2013. And once again, we're looking at tocotrienols, but we're looking at one of them specifically, alpha tocotrienol. And they said after a stroke, having sufficient levels of alpha tocotrienol in your brain help preserve and protect brain function. They found that during a stroke, the stroke damages something called microRNAs. Now that's interesting. But if you had enough tocotrienol in your brain, specifically alpha tocotrienol, it prevented damage to this genetic material. In your chromosomes and in the power plants of your brain, of your cells all throughout your body, but you have so many of these power plants in your brain, they're called mitochondria, there's DNA. And DNA is a template. It's a blueprint for different functions and structures, etc., throughout the human body. And for the DNA to function, you have to have RNA pluck it out and put everything together properly. And what they found is, during a stroke specifically, the damage that affects your ability to speak and talk and everything else is associated with damage to this microRNA, and they found that tocotrienol preserves the microRNA. So they're actually finding a reason why the tocotrienols work, and it's above and beyond their anti-inflammatory, antioxidant activity. They're actually working at the level of the genetic material. So these are important supplements, and you don't need a lot. Once again, you just need a little bit. So here's, I think, the coup de grace. Vitamin E tocotrienols, their effect on brain white matter. Now that's really important. White matter is about 50% of your brain. It insulates the gray matter. It controls the communication between different parts of the brain, different organs of the brain with the gray matter. The gray matter is where your memory takes place and your GPS and all these other things that make you so human and so smart and so clever. That's where all your cognitive functions take place and all. Whereas the gray matter gets its color from blood vessels. The white matter gets its color from insulation. It's called myelin. Myelin is an insulation on the nerves in your brain, and it makes the transmittal of information, the impulses in the brain, faster, so that you get the information very quickly, and your brain is working amazingly well. So the white matter is the communication and the insulation and the protective network in the brain. It's about 50% of your brain, and it insulates the gray matter, and it also connects to different parts of the gray matter, so your brain functions properly. Here's the thing. Damage in the brain travels through the white matter. So when there's damage in the white matter, it grows in the white matter and it spreads. So if people have had multiple concussions or multiple mini strokes, the damage is taking place in the white matter and it's spreading into the gray matter. And that's ferocious and awful. So there was a study performed. It was published in a really good journal. It was published in the journal Stroke. It was funded by the American Heart Association, and it was people with white matter hyperintensities. So there was a study performed. It was published in the journal Stroke, which is one of the major journals of the American Heart Association. And it was actually funded partially by the American Heart Association. And it was 121 people with white matter hyperintensities. So let me explain what that is. They give you an MRI, a very powerful imaging diagnostic tool of the brain, and damage in the white matter shows up as something called a hyperintensity, like a dark spot in the white matter. And that's bad because that grows and that spreads. Okay, so there was a study published in the journal Stroke, which is one of the major journals of the American Heart Association. It was funded by the American Heart Association, actually. And it's looking at vitamin E and white matter hyperintensities. And that's important. A white matter hyperintensity shows up on a functional MRI. An MRI is this powerful imaging tool that you can use on the brain. And a white matter hyperintensity is a pocket of damage in the white matter. And that's usually associated with damage to the brain. And what causes it could be diabetes or smoking or alcoholism or severe high blood pressure that was never taken care of. There's some kind of pathology that can cause it in younger people because some of these people are younger. But in older people, it's a more natural occurrence. Doesn't mean it's good, but it does occur naturally with advancing age. And there's very powerful evidence that white matter hyperintensities, they're important clinically because they're markers of a big risk of a stroke or developing Alzheimer's disease and other dementias or developing depression or having trouble coordinating your movements like impaired gait, like trouble walking, a problem with mobility, even death. So when they do these studies, they're important. And they found that it was 121 people with white matter hyperintensities on functional MRIs. They gave them either placebo or 400 milligrams of mixed tocotrienols every day for 2 years. And they had a really good result. They found that in the people on placebo, the damage got worse and worse. The damage was growing and it was spreading throughout the brain. But on the people on the tocotrienol, it prevented the damage in the brain from growing. It was stopping it from spreading. They went back 1 year later. They haven't published the second part of the study yet. They went back 1 year later and they investigated the brain health again. They did a further functional MRIs, and they found that people on the tocotrienols, there was even evidence that the brain was healing. So tocotrienols have a profound effect on brain health. So let's give you a call to action. I think it's really important that if you get vitamin E, it has to be in a natural form. The tocopherols, this would be your grandparents' version of vitamin E. But for us now, with all this additional data, we have to know tocotrienols are exceedingly important. There's studies showing that tocotrienols help protect prostate health to a degree in men, breast health to a degree in women. They're good for your blood vessel walls. They're good for cardiovascular health and circulation. They're excellent for the liver. They lower cholesterol. They're a very powerful antioxidant. But in the brain, they're exceptionally important. And you don't need a great deal. So if you buy a vitamin E supplement, make sure it has all 8 forms of vitamin E in it. The 4 tocopherols, the 4 tocotrienols. It'll work better. It'll be more protective for your brain. And if you get a multi, make sure, they always use vitamin E in a multi, but make sure the vitamin E in your multi is natural. It works much better than the synthetic form according to a great deal of data. The synthetic vitamin E just doesn't seem to be protective at all. And a lot of those once per day type of multivitamins use synthetic vitamin E to keep their costs down. They don't use the best grade supplements available. They might make the product properly. It might be a well-made product, but they're not from the get-go using high-quality ingredients. So that's an important point. When you get your multivitamin, make sure it has the tocopherols and it has the tocotrienols. In any event, thank you for tuning into the Invite Health podcast. But before I go, let me give you a couple of email addresses. If you have questions on anything I said, you can email me directly, jhickey@invitehealth.com. I'll give you that email again, jhickey@invitehealth.com. There are people emailing me already from these podcasts, even though we just instituted them rather recently. I'll give you an email address that goes to 5 of my nutritionists in case you have questions about anything I said on any of these episodes, or you just want to ask some kind of general nutrition question. There's no cost to that, and these are really well-educated people. nutrition@invitehealth.com. I dedicate 5 of my nutritionists to that email address. It's not the only thing they're doing all day. They're talking to clients, etc. But they do cater to these emails. Nutrition@invitehealth.com. So thanks for tuning into the podcast. You can find all of our episodes for free wherever you listen, any podcast, or by visiting invitehealth.com/podcast. And please make sure you subscribe. Please leave us a review. You can follow us on Facebook, Twitter, and Instagram @InviteHealth. I hope to see you next time on another episode of the Invite Health podcast, and thank you so much for listening.